the International Foundation for Electoral Systems. This 9-part virtual series addresses broad, cross-cutting issues that impact both countries: emerging security issues, COVID-19, regional and bilateral trade and investment, and democracy and civil society. It features American and Indonesian experts with diverse yet complementary backgrounds to examine the trajectory of US-Indonesia relations in the new normal. My name is Crystal Pryor, and I'm Director of Nonproliferation, Technology, and Fellowships at the Pacific Forum. Please note that this session features simultaneous interpretation. You may access English or Bahasa Indonesia channels using the globe on the bottom right portion of your screen. Our fourth and most recent session held earlier this month was on Beyond Misinformation, Managing the COVID-19 Infodemic. Key findings from the webinar included: the phenomenon of QAnon demonstrates the sociological phenomenon of people placing more faith in information when it's sourced from a trusted individual. In both the US and Indonesia, a community-oriented approach needs to be part of the solution for mis- and disinformation. Keeping interactions fun, personal, and patient should be core goals of such an initiative. Digital literacy is in dire need of improvement in schools, and positive stories, such as vaccine successes, need to be amplified. The full key findings are available on our website at the link appearing in the chat box now. You can also view our key findings from the first, second, and third sessions in the chat box now. We've posted edited videos in English and Indonesian of the first 2 sessions to Pacific Forum's YouTube channel, with videos of the third and on to follow in the near future. Today's session will focus on elections in the time of COVID-19. In December 2020, Indonesia held a nationwide series of elections for leaders of various local jurisdictions. Involving more than 100 million voters and tens of millions of organizers throughout the country, these were some of the world's largest elections to be held under strict pandemic lockdowns. While concerns mounted regarding overall safety, rigorous implementation of health protocols, adjustments at various stages to accommodate all relevant stakeholders, and strong monitoring by civil society and official watchers delivered a smooth transition of power. This webinar aims to discuss lessons learned and best practices from these massive elections held during the COVID-19 pandemic, as well as discussing the implications for general health protocols and countermeasures for possible future health crises. Please note that remarks made in today's program are on the record, and a video-audio recording of this session will be made available on the Pacific Forum website and social media in the future. This event will be live streamed to the CSIS Indonesia YouTube channel as well. As a reminder to our speakers today, please speak slowly and clearly for our interpreters. I'd now like to introduce Fausto de Guzman, Political Officer from the US Embassy Jakarta, to give some brief welcome remarks.
Good morning, esteemed panelists, partners, and guests from across the region. Before I begin with my remarks, I want to thank the Pacific Forum International, CSIS, and IFES for putting on this event and inviting me to provide some opening remarks. My name is Fausto de Guzman, and I work at the political section at the US Embassy here in Jakarta. To start, I want to reiterate the Biden administration is committed to working closely with our partners and allies, including through multilateral engagement, to achieve our shared objectives of a more peaceful, prosperous, and just world. The United States and Indonesia have been friends for many, many years. We have forged strong bilateral relationships many decades ago, and it continues to strengthen, especially under President Biden. Indonesia and the United States have many things in common. We are one of the biggest democracies in the world, with roughly the same population size and a great deal of diversity between our people. And the way we conduct our democracy has so much similarity between each other as well. The principle that underpins our country are also similar. The United States motto, E pluribus unum, represents the same idea with that we see under Indonesia's motto, Bhinneka Tunggal Ika. Both roughly mean unity in diversity. Indonesia is also a leader of democracy in the region. The Bali Democracy Forum, hosted a few years back, is only one of many examples of that. These underpinning principles and similarities mean we also face the same challenges and dynamism in manifesting our democracy. Such is why the friendship between the United States and Indonesia is a commitment we vow to continue. In a democratic country, elections play a very crucial role. A free and fair election is enshrined in the Constitution as part of a citizen's fundamental right of expression. A free and fair election also ensures the realization of every voter's freedom to have and express their political opinions. Also, a free and fair election is also labor intensive. It needs a lot of preparation, on-the-ground work, and supervision from many stakeholders. This is difficult to do with the COVID-19 pandemic, in which physical distancing is required to guarantee the safety of public health. Some experts have also indicated the importance of preparing for longer periods of the pandemic, as seen in some of the recent surges. As such, we are faced with a dilemma. On one hand, we cannot lessen an election's scope or delay it too long. On the other hand, public health safety and protocols must not be compromised either. Addressing this challenge is one of the themes today. We look forward to hear best practices on how to navigate elections in the middle of a public health crisis. And we have many experts here today as well. Thank you very much to Commissioner Evi Novida Ginting of the General Election Commission from the Republic of Indonesia, and Commissioner Fritz Siregar of the Election Supervisory Body for sharing your experience and thoughts with us this morning. We also would like to thank Staffan Darnolf, Director of the Program Development and Innovation Center at the International Foundation for Electoral Systems, IFES. Philips Vermonte from CSIS Indonesia for leading this panel discussion today. We hope the discussion this morning can share valuable insights, not just about the past election, but best practices that we can use for future electoral and democratic practices. You are encouraged to ask a lot of questions, and please do so. Thank you again, and welcome to the event, and have a wonderful discussions ahead. Thank you.
Thank you very much, Mr. de Guzman. I'd like to now introduce Dr. Phillips J. Vermonte from CSIS to welcome you to the program.
Thank you, Crystal. Welcome to this morning webinar or evening webinar, depending on where you are at right now. I know that some of you are joining from Washington, D.C. or other places across the globe. And I'd like to say that CSIS Indonesia is proud to collaborate with the Pacific Forum and the U.S. Embassy in Jakarta to deliver this webinar series on adapting to COVID-19. As we know, the COVID-19 pandemic that began in March 2020 has affected so many countries, all societies and countries' rituals and routines, including running elections. At least data shows that 78 countries and territories around the world have decided to postpone their elections due to health concern and health crisis. But by the first semester of 2021, more than 100 countries, 55 of them that initially postponed their election, have decided to hold the elections. Those countries that brave enough to brace the storm include Indonesia and the US, in which the experience of which will be shared today. Indonesia, that originally planned to have its local elections on 23rd of September 2020, has to reschedule 3 months to ensure health protocols in place for the safety of over 100 million voters, as well as election officials. And I'd like to thank all the panelists who are willing to share their thoughts and experience today from the US and from Indonesia, that I would say would be very beneficial for us, academia, practitioners, policymakers, if you are joining this webinar. I look forward to hear today's esteemed panelists to share their lessons learned. And thank you, and I wish you a fruitful discussion. Back to you, Crystal.
Thanks very much for that warm welcome. For those of you just joining us, again, I am your overall MC for this event, Crystal Pryor of the Pacific Forum. We now have a poll question for our audience in advance of our discussion today. Here is the question. What measures will ensure the successful conduct of elections in the new normal? Your options are increased vaccination rollout, electronic voting, voting by mail, observing strict health protocols such as PPE, social distancing, well-ventilated venues, or extending voting dates. As we're waiting for those results to roll in, I'd like to let you know that Dr. Phillips Vermonte will be moderating today's discussion, which will include feedback and Q&A with the audience. Later, participants joining through Zoom will be allowed to unmute their mics to ask questions or give feedback, as well as ask questions in the Q&A box. Participants' cameras are disabled throughout the session. There will also be a post-event survey for our participants to fill out at the end of the event. Now to review the poll results. We had as the top answer, observing strict health protocols, with 38% of respondents choosing that one, followed by electronic voting as a second. And then the other options were a little bit lower, but it seems that there's strong consensus that observing strict health protocols will help ensure successful conduct of elections. Okay, I'm going to stop sharing that. And to move on now to today's session, please note that panelists are all speaking in their personal capacities, not on behalf of the US or Indonesian governments. I will now hand over the mic to Dr. Phillips Vermonte, Executive Director at CSIS, to moderate the discussion and Q&A.
Thank you, Crystal. Hi again. And thank you for the poll result. I voted for more vaccine rollout, actually, for the sake of transparency. Well, we'll do in the next 30 minutes, we'll do the 3 presentations together. And then it will be followed by a Q&A and discussion. And this is a friendly reminder to all the speakers to keep their presentation to 10 minutes so we can have enough time for discussion later on and questions. This session will be 90 minutes in total. Please remember to speak slowly and clearly for the interpreters. You may access the live interpretation for the participants. You may access the live interpretation feature using the globe icon located in the bottom right portion of your Zoom window. Note that participants are welcome to submit questions through the Q&A box during the presentation. In other words, you don't need to wait until the end of the presentations. We are going to have 3 esteemed speakers for this panel. The first will be Mr. Staffan Darnolf. As mentioned earlier, he's the Director of Program Development and Innovation Center of the International Foundation for Electoral System. The second speaker will be Ibu Evi Novida Ginting. She is the Commissioner of the General Election Commission of the Republic of Indonesia, or KPU. And then the third speaker will be Dr. Fritz Siregar. He's the Commissioner of the Election Supervisory Body of the Republic of Indonesia. First up, I'd like to introduce Dr. Staffan Darnolf. He has 30 years of experience as scholar and practitioners in the field of democratization and electoral processes. He specializes in electoral reform in emerging democracies and post-conflict societies. and he has published many books, articles, and chapters in peer-reviewed scholarly journals throughout his career. He is currently analyzing how the COVID-19 pandemic impacts election commission's abilities to properly plan and organize election during a public health crisis. And based on this research, IFES is identifying unique risks and applicable mitigative solutions to enable leaders and policymakers to make informed decisions about moving forward with election under difficult conditions. Dr. Darnolf, you have the 10 minutes now.
Thank you so much. Let me just share my screen so we can get the presentation going here. So first of all, thank you very much for the invitation. It's an honor to be with you here today. And I'm looking forward to a lively discussion and debate, and all protocols acknowledged. What I will be talking to you today about, it's probably more of an emerging best practice. I think it's still too early to say that we have definitively identified best international practice. And it will be based on a COVID-19 briefing series that IFES has developed over the last year, but also common experiences from working with election authorities in some 30 countries, planning and or holding elections during the COVID-19 pandemic. So there are a couple of things that we can take away from what we've learned so far when it comes to COVID-19 and the EMB leadership, the election management body's leadership. First of all, is the importance of doing public health risk assessments, particularly focusing on the COVID-19 before you start your election preparations. And based on this risk assessments, the need is to develop a mitigation plan. And each country is unique, whether that comes to how it does voter registration, organizing elections, the type of absentee functions that exist, and the results process. So therefore, it's not like we can take a blueprint from one country and automatically apply it in different. They're all unique circumstances that exist. And once we have this mitigation plan, it's extremely important that is being integrated into the election authority's operational plan. So it meets its new election calendar, but also identifies additional resources that will be needed to meet this pandemic. And if we're looking at this health risk assessment, which is really the core of core importance that the election authorities leadership is focusing on, often we see that the EMB is working with the Ministry of Health that might have the mandate, or if there is a national task force. And there are some benefits with that. First, of course, they will gain access to the necessary medical understanding of COVID-19, but also from a practical perspective of maybe Ministry of Health already has a stockpile of PPEs, personal protective equipment, that it can quickly gain access to. It doesn't have to go on the international market to buy PPEs. But if that's not the case, maybe the Ministry of Health has a list of good supplier of quality materials that they can use in order to more quickly secure the additional material. But there are also some risks involved in working with the task force or a Ministry of Health. In some countries, we've seen that the task force or the Ministry of Health might be highly politicized or not regarded as very effective. So then there might be political risk of working very closely with that entity. You could also be that the task force is primarily focusing on servicing the needs of the public health sector, which is understandable. That is the priority for the nation. But that also means that their interest in making decisions that are relevant for the election authority might come out very late. In fact, so late in some places that it's been impossible for the Commission to turn COVID-19 protocols into new procedures and actually implement improvements on election day. But I think it's important to keep in mind that what we knew about COVID-19 15, 16 months ago is very different to what we know about it today. At that time, it was the science was telling us there were two ways that the COVID-19 transmitted. One was person to person via droplets, or indirect via touching objects or surfaces. And they were basically of equal value, equal risk to us as citizens of our nations. So therefore, a lot of emphasis was put on cleaning protocols and finding the right chemicals in order to clean surfaces and reduce that transmission risk. Today, what we know now is slightly a different picture. It is the primary way that we communicate and attract the disease is from person to person via respiratory droplets. So the importance of social distancing while waiting in queue for a polling station or voter registration sites, the proper use of properly fitted face masks are increasingly essential, and also to conduct voter registration and election in well-ventilated locations, or sometimes even outside, and therefore reduce the risks. So in summary, when it comes to this, I'm not saying that we should ignore the transmission risk that exists from surfaces and the cleansing of hands. I'm just saying that sometimes, depending on where you might have to rebalance. It's not 50-50, maybe it's 75% focus on the person to person and only 25% focus on the surface and that risk factors. But I'm going to show some quick data slides here. What we've seen when we're doing our surveys in a number of countries is that on the average, about 1 in 5 voters are really hesitant to come forward on election day and cast their ballot because of the health crisis. So it is something we need to be very mindful of, because if we steamroll ahead with an election without doing safety protocols, most likely the voter turnout will come down. It's not always the case, but it's a high risk when it comes to that. So when we also did our surveys, what are the things that voters in some places are primarily concerned about that we need to be mindful of? If we're looking here in Serbia and Bosnia, where we did some surveys, and this is largely a trend that we can see across the globe where we're doing surveys, it's 2 things that voters are concerned about and they want us to address before they come forward and vote. And that is, make sure that there's enough social distancing when they're waiting outside of the polling station, but also inside of the polling station. And thereafter is face masks. So in that sense, what the voters are asking us is very much in line with the latest research when it comes to how COVID-19 is being transmitted. So this is my last slide. What are the operational challenges that an EMB needs to be mindful about? When it comes to the PPEs, there's 3 things. There need to be timely procurement, there needs to be sufficient quantities, and we need to be careful about the quality of the materials we're being produced. Often what we've seen is that an EMB might have been able to achieve 2 out of these 3. What do I mean by that? In some places, they might have timely received the materials so they can use it. It might be of enough quantity, but the quality has been so bad that it was really not really a useful investment in the PPE. In other places, they have enough quantity, enough quality, but it arrived too late. Again, then it was a futile exercise. One part that we've seen election authorities struggle with, that is securing enough poll workers, because in some places the poll workers have been so afraid of stepping forward and again being a poll worker that the day before election or shortly before election they simply travel somewhere else, so they're no longer available. And an election authority normally tend to recruit and train maybe an overage of 5% or 10%, But now we've seen sometimes 20, 30% of the poll workers are no longer available. So therefore, they will not have enough poll workers to do the job unless they have a larger emphasis on recruiting more staff for election duty. We've also seen quite a bit when it comes to voter education campaign, and they're doing well when it comes to including messages related to COVID-19 and how to mitigate this. But what we've seen they're forgetting is to also target their poll workers. So in their messaging, it's also important to send this messaging from the Election Commission to poll workers that they have their well-being in mind and they will be looked after as well. There will be PPEs and training on to how to reduce these risks. And therefore you will have less problem of poll workers not showing up. And finally, the recommendation, what we've seen in a number of places is reducing the risk by starting with postal voting or trying to introduce internet voting. Unfortunately, in a number of places, that is not really feasible for legal reasons, time, or a lack of resources. So the practical solution is then to have fewer voters in a polling station or a larger location as a polling location. That is sort of one practical way of dealing with social distancing. And thank you very much for listening to me, and I look forward to a fruitful discussion. Thank you.
Thank you, Dr. Darnolf, for the informative presentation, and thank you for keeping up with the time. Next, we are going to hear from Ms. Evi Novida Ginting, who has been the Commissioner of the Electoral Commission, General Election Commission of the Republic of Indonesia since 2017. She is now in charge of the Technical Election Affairs Division. Previously, she was a lecturer in the Faculty of Social and Political Science, University of North Sumatra in the city of Medan. And then she holds a master's degree in development studies from the same university. She has a long experience as a commissioner, previously served as commissioners of the Medan city in North Sumatra province in Indonesia, 2003 to 2008. And later on became the chairwoman of the election commission in that city from 2008 to 2013, and become the commissioner of the provincial level of the election commission. He was also member of the regional honorary council of election management bodies in North Sumatra province from 2014 to 2016. Ibu Evi Novida Ginting, the floor is yours. Sorry, before I forgot, she will present in Bahasa Indonesia. So if you want to hear the simultaneous translation, please click the globe icon at the bottom right of your Zoom screen, and then later on back to the English mode. Thank you.
Sudah bisa mulai?
Silakan Ibu.
Oke. Baik, terima kasih Philips, dan selamat siang pada semua pendengar yang mengikuti kegiatan ini dan para narasumber. Pada pagi hari ini, saya akan menyampaikan beberapa hal ya yang berkaitan dengan pandemi ya. Pada masa pandemi kita melaksanakan pemungutan suara untuk pemilihan kepala daerah di 270 daerah. Next. Nah, adapun yang akan saya sampaikan di dalam paparan ini tentang terkait dengan penundaan yang terjadi pada masa pandemi ya di dalam kegiatan pemilihan kepala daerah tersebut, dan bagaimana kita melakukan koordinasi dengan lembaga-lembaga negara lainnya yang berkaitan dengan persiapan untuk pelaksanaan pemilihan kepala daerah di masa pandemi, dan juga bagaimana kemudian isu-isu penting di saat kita akan menyelenggarakan pemilihan di masa pandemi COVID-19 tersebut. Dan beberapa hal yang kemudian menjadi kebijakan kita untuk mengatasi hal-hal yang kemudian agar tidak terjadi interaksi secara langsung untuk menghindari penyebaran terpaparnya COVID-19 kepada seluruh masyarakat pemilih yang ada di Indonesia. Nah, pertama sekali penundaan terjadi karena adanya pandemi pada waktu di bulan Maret dan April itu masuk ke Indonesia, dan kemudian kita mempersiapkan langkah-langkah yang kita lakukan adalah bagaimana kita kemudian melakukan pertemuan dengan para stakeholder dan juga terutama dengan pemerintah yang pada akhirnya pada tanggal 14 April 2020 ya kita menyepakati ya di dalam pertemuan dengan pemerintah dan juga DPR parlemen ya di mana kita akan menggeser tanggal pemungutan suara dari 29 September 2020 ke tanggal 9 Desember 2020. Jadi ada penundaan pelaksanaan pemilihan kepala daerah diakibatkan pandemi yang semakin meningkat di Indonesia ya. Nah, dalam rangka untuk pelaksanaan pemilihan kepala daerah ini, keputusan KPU, pemerintah dan juga parlemen sepakat untuk tetap melaksanakan pemilihan kepala daerah dengan melakukan beberapa waktu penundaan, beberapa bulan penundaan, tapi kemudian kita juga mempersiapkan regulasi ya, regulasinya kita juga tidak mempersiapkan adanya penundaan dan persiapan yang berkaitan dengan bencana non alam ini. Nah, tapi kita punya aturan yang memuat tentang penundaan untuk bencana yang berkaitan dengan alam. Nah, oleh karena itulah kemudian kita melakukan perubahan-perubahan, terutama pemerintah mengeluarkan peraturan pengganti undang-undang agar pelaksanaan pemilihan kepala daerah ini bisa memiliki kekuatan hukum dilaksanakan pada masa pandemi ya, dan dilakukan penundaan dan dilaksanakan pada masa pandemi 2020 kemarin. Next. Nah, adapun koordinasi yang dilakukan ya, diantaranya adalah dengan parlemen di mana kita menetapkan tanggal hari pemungutan suaranya di tanggal 9 Desember dan kemudian kita melakukan rapat koordinasi yang intensif bersama dengan gugus tugas ya, gugus tugas COVID-19, Kementerian Dalam Negeri dan juga Kementerian Koordinator Politik Hukum dan Keamanan. Nah, yang paling intensif sekali kita melakukan berbagai pertemuan dengan gugus tugas di mana kita melakukan konsultasi ya terkait dengan persiapan-persiapan yang harus dilakukan di dalam mengatasi ataupun menghindari terjadinya terpaparnya COVID-19 ini kepada masyarakat pemilih. Nah, kemudian hasil dari pertemuan dengan seluruh lembaga tersebut kita menuangkannya di dalam peraturan KPU yang berkaitan dengan pelaksanaan pemilihan kepala daerah di masa pandemi. Jadi protokol kesehatan, hal-hal yang kemudian sangat penting untuk mencegah penyebaran COVID ini kita tuangkan di dalam peraturan KPU yang kita rumuskan dan kita atur bersama-sama dengan seluruh lembaga-lembaga khususnya gugus tugas. Nah, selanjutnya next. Wilayah-wilayah dengan, nah ini saya menampilkan data tentang 270 daerah yang melaksanakan pemilihan kepala daerah ya, di mana paling besarnya itu adalah yang memiliki resiko menengah. Ya. Jadi kalau 17 ada resiko yang sangat tinggi, ya, dan ada 76 daerah yang memiliki resiko rendah. Jadi dalam kondisi seperti inilah kemudian pemilihan kepala daerah kita laksanakan di 270 daerah. Next. Selanjutnya pemilihan kepala daerah tanggal 9 Desember. Next. pada tanggal 9 Desember dilaksanakan di Indonesia ya. Dengan kami menyediakan 298.938 TPS yang melibatkan 3.004.855 petugas penyelenggara kita di tingkat bawah. Nah, dari 270 daerah ini seluruh pemilih yang kita daftarkan di dalam daftar pemilih kita itu sejumlah 100.359 152 pemilih yang di dalamnya sudah termasuk pemilih pemula itu 3.517.256 pemilih dari pemula. Nah, seluruhan ini kita laksanakan di tanggal 9 Desember dengan tentu saja pelaksanaannya yang dimana kita merekrut petugas kita ini sudah dilakukan langkah-langkah untuk mencegah penyebaran COVID, di mana kita melakukan tes rapid antigen ya untuk keseluruhan rapid pada keseluruhan dari penyelenggara badan ad hoc kita. Nah ini kemudian memang kita temukan di beberapa daerah terdapat penyelenggara juga yang tidak bisa melakukan tugasnya dan kemudian harus diganti karena ternyata reaktif dan positif. Gitu ya. Tapi karena waktu masih memungkinkan, kita dapat melakukan pergantian untuk mengisi kekosongan dari mereka yang terkena COVID ya. Nah, isu-isu penting tersebut kemudian ada langkah-langkah yang sudah kita lakukan ya. Next saja. Lanjut ke slide yang next. Untuk mempersingkat waktu, next. Ya, ada perubahan yang terjadi pada masa kami melaksanakan pemilihan kepala daerah di masa pandemi. Pertama adalah merubah metode kampanye di mana yang berkaitan dengan banyaknya kerumunan ataupun gunakan banyak orang, kita kemudian menghapus seluruh metode tersebut dan menggantinya dengan sosial media ataupun media online. Jadi kemudian ini kita lakukan dan kemudian kita juga yang tadinya tidak mengatur waktu untuk pemilih datang ke TPS, pada akhirnya kita memberikan waktu-waktu tertentu untuk mereka datang sehingga sehingga kita harapkan tidak terjadi penumpukan pemilih pada saat menggunakan hak pilihnya. Dan kemudian kita melakukan membuat protokol kesehatan di mana kita menyediakan tempat mencuci tangan, kemudian kita mengatur jarak pemilih dan menyediakan termogan yang di setiap TPS dan kemudian kita juga menyediakan sarung tangan dan mempersiapkan bilik khusus di mana apabila ditemukan pemilih yang lebih dari 37,3 suhu tubuhnya itu akan ditempatkan di dalam bilik khusus untuk melakukan pemungutan suara. Next. Dan kami juga melakukan kebijakan di mana seharusnya maksimal pemilih dalam satu TPS. Next. Di dalam satu TPS itu berjumlah 800 orang, tetapi kemudian kita mengurangi menjadi maksimal 500 pemilih. Kemudian kita mempersiapkan seluruh kelengkapan APD, alat perlengkapan kesehatan, yaitu seperti masker, sarung tangan, penyemprotan di TPS. Itu semua kita lakukan, bagaimana kita bisa memastikan seluruh pemilih yang datang sehat, kemudian ketika dia sudah memberikan suara, dia juga harus tetap sehat. Nah, oleh karena itu di TPS juga kita sediakan di pintu keluar, pintu masuk dan pintu keluar itu adalah alat pencuci tangan dan juga kemudian di dalam TPS mereka terus menggunakan sarung tangan. Nah, perubahan yang berikutnya yang kita lakukan adalah tadinya kita melakukan memberikan tanda dengan mencelupkan jari ke dalam tinta. Pada saat ini kita sudah berubahnya dengan melakukan penetesan tinta ya kepada jari yang dimiliki oleh pemilih ketika dia sudah memberikan suara. Nah, seluruh kelengkapan ini kita berikan untuk memberikan kenyamanan, keamanan kepada para pemilih yang datang ke TPS. Demikian karena waktu sudah tidak mencukupi. Terakhir saya ingin menyampaikan bahwa pada saat pemilihan kepala daerah kita menggunakan sistem informasi rekapitulasi yang kita gunakan dalam rangka untuk mengurangi penggunaan kertas ataupun kemudian dalam rangka untuk publikasi dan transparansi serta akuntabilitas sehingga proses penghitungan suara di TPS sudah bisa diakses oleh publik dalam waktu yang cepat. Demikian saya sampaikan, Philip, sudah waktunya saya mengakhiri. Terima kasih, mudah-mudahan bermanfaat dan nanti akan kita teruskan dengan tanya jawab.
Thank you, Ibu Evi, for the presentation. We can continue the discussion later on during the Q&A. Now, last but not least, I'd like to invite Dr. Fritz Siregar, who was appointed in 2017 by the President of the Republic of Indonesia to the Election Supervisory Board for the period of 2017 to 2022. Fritz completed his SJD in July 2016 at the University of New South Wales, Australia. He has a lot of experience in doing research of the judicial behavior and also on the Indonesian Constitutional Court. Now 10 minutes is yours, Pak Fritz.
Yeah. Thank you, Philip. I hope you can hear my voice. Good morning, good evening, and good afternoon for all the participants and all the speakers. And my name is Fritz Siregar. I am from Indonesia Election Supervisory Board, and I will try to use my 10 minutes as effectively that I can. So, as you already aware that in Indonesia we have 3 organizations that has the responsibility to conduct or to doing the elections. First, we have election commissions, whether Ibu Evi Novida Ginting is already spoke, and after that we have Indonesia Election Supervisory Board. This is my office, and the second is the Honorary Etika Council or the KPP. They are the 3 organizations. So I will try to share my screen. So as mentioned by Ibu Novita and also by Staffan, that there is political discussion with public and also with the parliament whether we have to continue the election or not, because we're supposed to do the election in September 2020, but we postponed to the December 2020. Of course, during that time, many people say that we have to postpone until 2021. There is also postponed to 2022, but the choice is there, and we have to involve with many stakeholders, as many as we can, in order to make the final decision whether we do or not do the election. Of course, we finally agree for 9th of December with several adjustment. We need to we have to make some changes with the law. We have to need more budget, and we have to more public participation. We have to more involvement with other government institutions, and of course there is new mechanism that need to be in place. That what we call it health protocol. If in the before the COVID we only talk about the election administrations. Now we have to impose the health protocols as part of the election administrations in all the process. So, of course, from Bawaslu point of view, as the election supervisory board, we have to ensure many things. First, we have to ensure that all the regulations in KPU and election commissions, and also us in election supervisory board, is in line with the new health protocols, and is not only in the one cycles, but it's all election cycles, or also is already should be changing. the law, our internal regulation also need to be changing, and also our way to do the practice is also need to changing. And massive communication, as also discussed by Stephen, that massive communication is being conducted not only us but also by other government institutions. Of course, as the election supervisory board, they are challenging how to supervise the voter registrations, how to supervise verification of independent candidate, and how to supervise updating voter list. In the beginning, there is a questions: can we do all the things online? Can we do the verification of independent candidate online, or do we do everything with online? And for sure, we cannot do it by online. Some adjustment it need to be doing, like of course, like for the verification, face-to-face verifications need to be done, but using the mask and using the health protocol. And it's like for the campaign, yes, we are trying to do online campaign, but still town hall meeting is still okay to be done, but with limitation, with the process for approval, and also with the number of the people that the limited. Of course, for the updating voter list also need some adjustment. In the past, the election official will come and knock every door to asking about their final identity, but now they have to doing also through the online. Of course, as the Bawaslu, we need also to adapt. We adapt like because the Bawaslu not only for supervising, but also we have for to handling complaint, administrative complaint, criminal complaint, and also dispute resolution, particularly for the for candidasi complaint. They are something that we are trying to build in the past, but we not able to do it. But we able to did that during 2020. So we have many places in which the full hearing from the petitioner, from responder, to get the testimony we are doing through the online. And as mentioned also by Ibu Evi, so we have 100 million voters registers and also 290 polling stations. So I try to put two perspectives. I have to respond our result of our supervisions. First, about the registration process. Yes, we are making change the law to respect the health protocols. But in the beginning of the process, the health protocol is not respected. So there are almost 46 candidates during the registration process is already being positive COVID, and they are not able to submit the application by themselves. So during the registration process for until 6 September, we are reported to for 243 health protocol violations, and mostly the violation is regard not respect about the space, and also gather people more than it should be. And now we are going to the second report that I want. First is about the report that assignment is regard the registration process is about the campaign. So even though it's the law and the government is trying to impose online campaign, but still all the candidates they have prefer to use face-to-face campaign. And of course, because of the face-to-face campaign, we find there are almost 2,500 violation of the health protocol, in which we have to submit the warning letter, and there are 239 campaign need to be dismissed. On the election day, as mentioned by Ibu Evi, we are imposed the strict health protocol. And during the the one that we have to look that whether even though that the election conducted during the COVID-19, but the turnout is increased from 2015. 2015 is only 69%, but on 2020 it's 75.82%. And if I ask why the number of the people is come, I think it's the idea or to support the election is not only the job of the election commission or the election supervisory board, but like as Staffan says, it's everybody. Like I say, like it's the big orchestra between the Minister of Interior, Minister of Health, Minister of the Information, local government, central government, and all people is asking to let's go for the polling stations, but respect to the health protocol. So during the D-Day, we have found out that there are 2,049 health protocols. Even though this is the health protocol because there is no hand washing facility on the polling stations. Yes, during the D-Day, we still find irregularity. We still find what we call it normal violation that still do, like ballot paper is missing, or there are still ballot paper exchange. The traditional administrative violations that conduct by the D-Day is still there, but also we found what the health protocol violation. So as the closing for my presentation is, as the election supervisory board, we have looking to respect. There is also criminal violation of the health protocols, and how we ask people to respect the health protocol, and also there is a charging for health protocols that already being regulated by the criminal provision. This is also something that we have to discuss, that of course there is a possibility for the criminal charges for the health protocols. I think this is my presentations, so maybe we can discuss for further during the Q&A. Thank you, Philips.
Thank you, Pak Fritz, for a very interesting presentation and data showing. Now we are in the Q&A session. We are having about 25 minutes to 30 minutes. And for those of you joining this webinar, you can post your question through the chat box or Q&A box. But I haven't seen any, but I do have some questions, if I may, while we are waiting for the participants of the webinar to post their questions. Now, I think first question to Dr. Darnolf. I mean, comparing what you've been presenting, what you presented, and what Dr. Fritz Siregar presented, would you kindly inform us what are the measures for violations in if you have some data comparisons about how the governments in concern, you showed the Serbia, Bosnia, and Georgia who are having this elections during the pandemic. Do they have some kind of penalties or law on the in place so that they can enforce any laws if there are violations of health protocols? That would be a very nice comparison to what Dr. Fritz have been trying to tell us here. And then probably second question to Ibu Evi. I quickly look at my data on the on the COVID-19 cases in Indonesia after December 9th. That we did the local regional head elections in December 9th, and this is also probably to Pak Fritz as well. Pak Fritz said about the enforcement of the law, but in terms of new cases, I think after 9th of December 2020, on the 9th of September, we had about 5,200 new cases across Indonesia. But then 2 weeks later, a few days later, and then up to 2 weeks later, the new cases jump and triple in some places. So what I'm saying is that what would be the evaluations of all these strict protocols that we were having back then that did not properly work to prevent new cases. So the question might be about the deliberation about the postponement or about any possible further postponement of the elections in Indonesia, because new cases always doubled or tripled in public holidays, and in this case in the election time in Indonesia. What would be your thoughts on that, Pak Fritz and Bu Evi? Dr. Darnolf, first, if you may respond to the question.
Sure. Thank you very much for the question. It's a very good one. And to a certain extent, we haven't seen in many places that have issued new sort of penalties directly related to violation of health protocols for elections. They've been more generic in nature and covered sort of in all different settings, would be in restaurants or in hotels or in offices and these things. It's not that they've been specifically designed just for election as such. What we've seen in a number of places, though, is they might have had what seems to be reasonable penalties that could be a deterrent, but there's often a lack of enforcement. And I think that's one of the biggest problems, that people learned quickly during the campaign period that, they could largely do as they see fit. So therefore, there was difficulties for the election authority to enforce them on election day, and especially if the security forces didn't see that as part of their mandate to enforce sort of health-related security issues. They were more thinking in the old traditional way of physical security, or someone has a knife or something like that. That's what their mindset. So there was, in a lot of places, a bit of a gap when it comes to who is the enforcing authority when it comes to these things. And if I may, I'm just going to jump into your question when it comes to the spike in number of cases, because we've seen that in other places as well. But we have had difficulties determine if that was strictly related to election day, or if it was because of the intensive campaign period that happened just, those couple of days before as well. And because sometimes it was a blur, some of these individuals that were involved in the campaigning, be they for the political parties, candidates, or voters, were the same people that went out on election day. So it's difficult to determine where did the spread actually take place. But that's just a general observation. So thank you very much.
Thank you, Dr. Darnolf. Silakan Ibu Evi. Ibu Evi.
Ya, terima kasih, Philips. Ya, memang kita tentu terus berupaya pada saat pemilihan kepala daerah untuk menegakkan protokol kesehatan. Tapi kalau kita lihat misalnya dari data Satgas COVID ya, itu kepatuhan terhadap protokol kesehatan itu mencapai 96% pada saat pemilihan kepala daerah. Nah, tentu kita juga pada setelah pemilihan kepala daerah tidak ada melihat munculnya klaster pilkada gitu ya di masyarakatnya, bahwa kemudian ada peningkatan, ya ini memang perlu dicek kembali apakah ini bukan karena hari libur yang cukup banyak ya. Setelah pemilihan kepala daerah itu kan hari Rabu, setelah itu ada hari libur. Kemudian juga menjelang Natal itu kan cukup beberapa kali ada libur yang cukup di dalam minggu-minggu setelah hari pemungutan suara. Nah itu yang terus kita pantau ya pada saat itu, dan Jelas bahwa pemilihan kepala daerah pada saat 9 Desember itu tidak menimbulkan klaster baru ya, dan artinya protokol kesehatan yang ditegakkan pada saat pemilihan kepala daerah ini memberikan hasil di mana tidak munculnya klaster baru, dan itu diyakini oleh data Satgas COVID 96% seluruh TPS itu mematuhi protokol kesehatan. Mana juga antisipasi kita penyelenggaranya sendiri juga sudah kita cek ya, sudah kita lakukan cek rapid ya. Mana kalau reaktif tadi seperti yang saya sampaikan kita langsung melakukan penggantian. Jadi upaya-upaya tersebut di dalam mencegah penyebaran COVID ini sudah kita lakukan semaksimal mungkin, dan hasilnya juga di mana partisipasi yang juga cukup meningkat ya dari 5 tahun yang lalu, di mana jumlah pilkadanya juga daerah-daerah yang pilkada itu sama gitu 200. Demikian Philip.
Thank you, Ibu Evi. Pak Fritz, if I may add questions to what I already asked is, how would you enforce all these criminal codes and all the violations? The rules and regulations are there, but did you or the supervisory body actually enforce the law in coordination with the police or with the governors, mayors, and so on?
Yeah, thanks, Philip. I think this is very interesting question, because I think this is the hiccup. I think because the health protocol is in KPU KPU regulation, in election commission regulation, is only administrative procedures. So we're talking about health protocols that governed by election commission regulations and by the criminal law, and we can impose the health protocol violations that governed by election commission regulations by providing administrative letter, by postpone the campaign or dismiss the campaign. But with regard the health protocols that governed by criminal code or quarantine law, the enforcement is relied to the police, and the police say, and the mindset of the police that is, we are in the election process, and because of the election process, all the criminal charges we have to respect to regulation that already being conducted by the election commission regulation. So as far as I understood, all the health protocols like gatherings more than it should be or not respect the space, it governed by election commission regulations. So it's not so the violation is not being charged by criminals law. So I think this is also this is the balance, because we cannot erase all the town hall meeting. We cannot impose every campaign should be in through the media online, through the social media, or through the television or the radio, because there are some part of in Indonesia that not have the luxury to have those facilities. So some of the misconduct with the health protocol is still has been conducted in many areas.
Thank you, Pak Fritz. We do have questions from YouTube. Those who are participating YouTube, let me read the question. To Pak Fritz and Bu Evi, this is a question from Karen Budianta through YouTube. Why we are not now thinking about electronic voting or vote by mail? That will be more that will be safer for the election workers as well as the voters. That's one quick question, but I think it is going to be hard question to answer. please, but if you have any thoughts on this, question on electronic voting and vote by mail, maybe Pak Fritz first, and then Ibu Evi. Very quick one.
Yes, because Ibu Evi will have long answer for it. I think for us, because we have to realize that Indonesia is big country, so we are talking about the internet. I mean, there is no need to explain about the availability the internet in remote area. Just go to the West Java or Central Java. In the middle of that province, we still have many blank spot. And so for me personally, I mean, I am okay if we started regularly or gradually to use the electronic voting or using the voting machine. Like maybe for example, maybe for 2024, we're using the internet voting for our overseas voters, for the people that living outside of Indonesia. Maybe we try in that area. And after that, maybe another 2019, we use in the big city, maybe in Jakarta, Medan, Sulawesi. So we use it the gradually, because we are talking about the transformation of the power. Because I think about the voting through the online. I mean, what the most important thing from the election process is trust. Is people trust with the process? Is the people trust when they go to the polling booth and they are punching, they know that their vote is count. So I think that process is need to be adjusted and to need to be developed, because if you are going to the polling station with the ballot paper, you know that you are punching, and if there is dispute, you can open the box and we look and we try to recount. There is the evidence. But what if there is the electronic voting? There is nothing that you can hold. And if there is the dispute, particularly with respect to Indonesia situations where the dispute is always come in all the elections, people trust, I think it's not easy to get with it. That's my answer, Peter.
Thank you. And people do not trust whenever they could not see things. Probably they do not trust that the virus exists as well. They couldn't see the virus, so they go on with the campaign. That's a side joke. Ibu Evi.
Ya, terima kasih Philips. Ya, tadi sebenarnya sudah dijawab sama Pak Fritz cukup tepat gitu ya. Tapi begini, kita tidak menutup kemungkinan bisa menggunakan e-voting di masa yang akan datang, ataupun pos sendiri sudah kita gunakan untuk pemilu di luar negeri ya. Jadi kalau di luar negeri kita sudah menggunakan pos. Apakah kemudian ini bisa diterapkan di Indonesia? Nah, secara keseluruhan untuk pemilu maupun pemilihan kepala daerah ini tentu masih panjang perjalanannya, karena Indonesia telah membuat satu kajian dan menyimpulkan bahwa pemungutan suara yang diberikan secara langsung dan kemudian penghitungan suara diberikan secara disaksikan oleh semua pemilih, bisa disaksikan langsung. Ini sebagai bentuk transparansi ya, diberikan kesempatan kepada semua pihak untuk bisa menyaksikannya dan mengikutinya secara langsung. Walaupun memang pada masa pandemi ini kita perlu memikirkan cara-cara ataupun langkah-langkah untuk mencegah terjadinya penyebaran COVID-19 ini. Nah, oleh karena itu sebenarnya yang kemarin kita laksanakan di pemilihan kepala daerah, kita menawarkan dengan penggunaan elektronik rekap, gitu ya, rekapitulasi, Siregar kami mengatakannya, sistem informasi rekapitulasi, yang tujuannya juga untuk mempercepat proses penghitungan suara dan juga mengurangi kontak di antara para penyelenggara pemilu dengan saksi maupun panwas di satu tempat. Nah, ini kemudian kalau proses penghitungan suara ini bisa selesai cepat, kemudian rekapitulasinya yang berjenjang kemudian juga bisa dilakukan dengan singkat dengan menggunakan sistem informasi rekapitulasi, di mana penghitungan suara kemudian kita foto, kita masukkan, kirim ke dalam server KPU, kemudian ini bisa diakses oleh rekapitulasi di jenjang berikutnya. Nah, proses ini bisa membuat proses penghitungan suara dan rekapitulasi itu menjadi semakin cepat, dan ini kita harapkan pada waktu itu bisa mengurangi kontak interaksi di antara seluruh penyelenggara maupun saksi dan panwas, sehingga proses rekapitulasi ini bisa diakses oleh publik, transparansinya terjamin, dan tentu kami berharap kalau ketika proses pemungutan suara dengan langsung, masih sekarang ini menggunakan langsung tidak dengan e-voting, ada jaminan bahwa kerahasiaannya tetap terjaga. Nah, e-voting sendiri di belakang hari ini kita lihat sudah mulai makin ditinggalkan gitu ya oleh penggunanya sendiri gitu ya yang sudah menggunakan. Nah, ini juga karena tentu saja setiap penggunaan sistem informasi elektronik ini upaya-upaya untuk melakukan hack-nya yang mengganggu keamanan daripada data-data yang dikirim ini juga semakin kencang, semakin banyak gitu ya. Nah, termasuk juga ketika kita menggunakan Siregar ini, ada upaya-upaya juga untuk melakukan. Tapi kita berkesimpulan bahwa Indonesia masih tetap menggunakan cara langsung ini, walaupun caranya untuk menghindari pandemi ini kita lakukan dengan protokol kesehatan yang ketat. Nah, ini yang harus kita, karena secara keseluruhan kita kan harus membiasakan dengan kehidupan normal, new normal ini ya. Jadi tentu masker yang sudah terbiasa kita gunakan, kemudian kita menggunakan alat tulis kita sendiri dan lain sebagainya, menggunakan sarung tangan. Ini new normal ini kemudian juga harus kita gunakan pada saat kita juga melakukan pemilu. Dan percobaan pertama pada pemilihan kepala daerah ini juga berhasil. Kemudian juga kita harapkan di tahun 2024 ya, walau saya tidak begitu yakin semuanya pandemi sudah selesai, tetapi saya berharap ini bisa diatasi dengan banyaknya juga kita sudah melakukan vaksin, dan ke depan di tahun 2024 kita akan lebih mengedepankan penggunaan sistem informasi dalam setiap tahapan pemilu. Terima kasih.
Thank you, Ibu Evi and Fritz. So that answers question coming from our YouTube channel as well as in the Q&A box. There are actually two similar questions on the use of e-voting or any information system to the election. Now we still have a few minutes because there have been no questions yet. I have one question to Mr. Darnolf, because you are from a global institution like IFES, and you, I think, can provide us with some helicopter view about the conduct of election during the pandemic time. We've seen elections being used to get re-elected. In South Korea, the President Moon have been successful in dealing with the COVID-19, and then he held the election and he got re-elected. And the Prime Minister of New Zealand, Jacinda, did the same wonderful thing in New Zealand, kind of quickly recover from COVID-19, and then she had the election and got re-elected. So would you say actually election might be a good place for governments across the globe at the national and local level to prove that they do public service delivery, so that they would concentrate on dealing with the COVID-19 so that they get re-elected, not vice versa. In some areas, as you mentioned, it can be politicized, the reported number lower than it actually is, and so on. So how would you see this from IFES or from Washington, D.C., given that the data that you have from across the globe?
I'm not sure if I'm going to thank you for that question, because that's almost politically, IFES, we don't really like to wander off into politics. We're election experts and stuff like that. But what I can say on to give you some sort of an answer on this, and I think it ties in generally when it comes to a crisis in the nation. If it is, if a natural disaster, or if it is, a health crisis, if the sitting government is able to, articulate the strategy and then also implement it well, of course, in most instances, the electorate will look favorably upon them, and then reward them at the ballot box. It's not 100% something like that, but we often tend to see a bit of a rally around the flag effect when we're having those kind of disasters in a society, and we think that our local, regional, and national leaders are able to step up and help us out, without too much inefficiencies, without corruptions and so on. So for sure, I should maybe also just quickly branch out and talk about on the e-voting question, because a few years back we were asked by the Norwegian authorities to evaluate their e-voting pilot, and then we also seen things, how it's gone in Germany and Austria when they've been testing e-voting. And as was mentioned earlier, one of the main reasons why these three nations decided to stop with the e-voting, even though they've spent tens and tens of millions of dollars on this, was the lack of trust in the system. Because the voters and the parties still didn't trust that it wouldn't be hacked, or they couldn't track their vote far enough into the system. So they didn't really trust. Yes, they could see that they had voted, but not how they voted. And that's the dilemma, because if you can see how you have voted, then you also can start selling your vote. And you can be intimidated, and you vote, and then you can then unlock your vote and then show whoever is intimidating you that you did vote the way they wanted, not the way you intended to vote. So sometimes it's the problem of guaranteeing the secrecy of the vote when you're doing e-voting. But normally when e-voting has been introduced in society, it has been in a pilot phase, and we've seen increasingly that it is the diaspora that tend to be a good way of doing it, because they tend to maybe live in under similar conditions where access to internet and these things might be easier and more feasible. So that is one way about it. Other sort of concerns when it comes to these kind of systems is, of course, as was mentioned by Evi, it's the hacking part of it. I mean, all these systems, there's only so much money you can throw at it. If you have a national adversary against you and they want to maybe not penetrate the system, but at least do denial of service attacks, sometimes it is difficult to defend against these kind of things. So I'll just stop there.
Thank you. So trust and the integrity of the electronic system are the two main concerns for this to be adopted anywhere. I think not only during the pandemic, but also in the non-pandemic situation as well. We do have about 5 minutes, so I have a quick question for the three of you, and then probably you do the closing statement through this question. But very briefly, Dr. Darnolf indicated in his presentation in one slide, I think it was about Georgia, and then actually only 18% of the respondents there responded to the question, what are the main concerns with the election during the pandemic time? They said only 18% said health reason, only 18% actually, and they listed other reasons why they would not go to the polling station. So health reason actually only 18%. So it seems to me that it is cultural matters that people are not really thinking very seriously about the pandemic, and that would pose challenge to anyone, election commissioners, governments, and then even politicians, and that culturally speaking, or at least in the mind of the voters, seems to me people are not really concerned about going to the polling station. If they are not going, it's not a health concern. It's something else. How would you see this question, maybe we can start with Pak Fritz and Ibu Evi very quickly, and then Dr. Darnolf. Pak Fritz, probably 2 minutes.
Yeah, I think this question is that's like I think is always come to my mind why the participation rate in Indonesia is higher during the pandemic compared to not the pandemic. So it's because of his local election. So it's close to the people. So because the patriarchy, the local culture, local leader, they has their political machine that working in many areas that asking people to vote, or maybe because of the discussion of whether we go to local election is are we going it or we cancel it, going it or cancel it. That discussion is come to all the media, and maybe it's because of it or maybe because the hard work of the election commission and all election officials and government to make sure that you can go to the polling stations and you will be safe. Because I think this is the way how we introduce the communication with the public, because I think it's conducted by Staffan and also by the Philips, that people has to trust with the process and all how we impose the health protocol in the polling stations with the mask, and the election commission provided plastic glove, and even though the election commission already provide the mask at the polling station as the backup, but what we witness in the polling station, most of the people come with their own mask. So they understand that when you are going to the polling station, you not only bring your ID, but you also use your mask. I think that mentality is spread out in all Indonesia. So I think, like Staffan has already mentioned, that the clarity about the process and the public communication, and also how we strict with the process at the polling stations, so people will understand that there is no problem for us to go into the polling stations. And I think there's the accountability, or not only for the election organization like the KPU and the Bawaslu, but also the government institutions, that elections is our job, that we need to work together. That's
Okay,
brief.
thank you, Pak Fritz. Thank you. Ibu Evi, 2 minutes. 2 menit, Ibu.
Ya, pertama tentu bagi kita KPU berhasil ya meyakinkan masyarakat TPS itu sehat gitu ya. Jadi Anda datang ke TPS dalam keadaan sehat, Anda akan keluar dari TPS juga sehat. Itu kita yakini dengan menegakkan prokes tadi. Dan kemudian tentu ada peran kandidat ya di dalam kampanye atau ya dalam pilihan-pilihan masyarakat yang mungkin pada waktu itu muncul banyak kandidat-kandidat yang juga populer gitu ya. Nah, kemudian ada isu tentang keamanan ya, tentang keamanan bahwa kesehatan ini pilkada ini akan mengancam kesehatan masyarakat gitu. Jadi isu-isu ini terus dijadikan sangat masif ya, dibicarakan di publik gitu, sehingga ini juga makin membuat sosialisasinya terhadap pemilihan kepala daerah ini cukup masif diketahui oleh masyarakat. Jadi perdebatan apakah harus ada pilkada atau tidak pada masa pandemi ini muncul sangat masif sekali, dan setiap hari, setiap saat di media sosial juga terjadi perdebatan-perdebatan. Nah, ini kemudian mendorong orang ingin tahu, menurut saya semakin ingin tahu dan meyakini bahwa benar nggak aman KPU-nya gitu ya. Jadi pada saat menyediakan TPS. Dan yang terakhir mungkin karena selalu pemungutan suara ini, kan itulah kenapa tadi saya katakan bahwa kita masih memilih untuk secara langsung datang ke TPS menggunakan hak pilih, karena TPS itu ditempatkan di lingkungan tempat tinggal. Jadi sebenarnya setiap ada pemungutan suara itu seperti pesta gitu ya, seperti pesta dan tempat silaturahmi ya dari seluruh mereka yang bertetanggaan, tinggal berdekatan dengan TPS. Selama ini tidak pernah bertemu, pada hari pemungutan suara mereka datang beramai-ramai ke TPS dan saling bersama untuk menegur satu sama lain ya. Jadi ini menjadi selalu satu momen kebahagiaan bagi masyarakat Indonesia kalau datang ke TPS gitu ya, berkumpul bersama. Nah, itulah kenapa kita masih tetap mempertahankan, salah satu alasan kita mempertahankan pemungutan suara secara langsung. Jadi tidak tentang persoalan pandemi ini tidak menjadi ketakutan yang cukup besar pada saat itu untuk datang ke TPS. Karena saya yakin tadi seperti Pak Fritz bilang sudah menggunakan masker dan juga mengikuti protokol kesehatan. Terima kasih, Philip.
Okay, thank you. Yes, thank you, Ibu Evi. Dr. Darnolf, 2 minutes for you. Same
Sure.
question.
Very quickly then. I think the turnout, it depends on, of course, the voter education and the trust that the citizen put in the election authority and how it's prepared it to be a safe exercise. But it also depends on where the nation is in terms of the COVID epidemic. Is it the beginning of the wave? Is it the middle of the wave? So I think that is a factor also that we've seen in other countries, how it's been impacted. For instance, it was only a couple of weeks ago in Canada for local elections where the election commission was forced. The election commission had planned to organize the election, but they were forced to cancel it because the local authorities refused to give them the schools as polling station, and the unions that a lot of the teachers belong to refused to release them as poll workers. So that was obviously a lack of trust, and there was a local outbreak of the virus there. So you can have that kind of impact as well. And then just lastly, when it comes to, since you pursue a lot of in-person direct voting, which makes total sense for me, it is that an experience from in the US where we drastically expanding the postal voting and did that successfully. And I think that's a really good way of exploring it, but also doing early voting over a longer period of time so people can come in person, but spread over more sort of weeks and cast it. And then you can more easily stagger them so you don't have these kind of queues and congregations. So thank you very much for the invite. It's been a fascinating, and I know I need to learn more about the recap system that was mentioned here because that sounds intriguing. So I will definitely learn something from this exercise as well. Thank you very much.
Thank you, Dr. Darnolf. I think that also marks the end of the discussion. It's been wonderful, so many lessons learned, and I hope through this discussion there will be more discussions coming and as to how we mitigate the question about COVID-19 and the conduct of election. I return the screen to Crystal. Back to you, Crystal.
Thank you so much, Dr. Phillips, for your excellent moderation. And thank you to our esteemed panelists and participants for joining us today. We weren't able to get to all of the questions sent in, but we do hope this is part of an ongoing dialogue between Indonesia, the US, and the region as a whole on holding safe and successful elections in the new normal. We hope you'll continue staying engaged with Pacific Forum programming, which you can find out more about on our website, www.pacforum.org. The 6th and 7th sessions in these series are slated for late July and late August. The topics will be related to countering violent extremism in youth and gender, women's empowerment, LGBTQIA issues. Please subscribe to our mailing list or follow us on social media for updates on these sessions. I'd also like to remind you of the bilingual post-event survey, which we'll share in the chat box now. We would really appreciate it if you would take a few minutes to complete it and share your feedback, as we would like to make the subsequent sessions as engaging and productive as possible. Thank you again to our speakers for joining us today, to our partners CSIS and IFES, and especially Dr. Phillips, and as well to the US Embassy, Jakarta, for making this event possible. We hope that we'll see you at the next event in these series. Goodbye.
Thank you. Thank you. Bye. Stay healthy.
Thank you very much.
Thank you. Stay healthy.
Thank you, Pak Fritz.
Bye,
Thank you, Pak
Philip.
Darnolf.
Thank you,
Bye.
Staffan.
Bye.